Hello, 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 everybody. Welcome, welcome. This is Kidney Stories 2 with your Uncle Jim, and I have something extra special for you tonight. Our guest is Amanda Grandinetti. Let me tell you a little bit about her. Amanda is an MPH. She is a manager of research in medical specialty where she leads the development, implementation, testing, and evaluation of quality measures. She has been involved in the development of clinical and practice guidelines and qualified clinical data registries. Amanda has dedicated her career to helping physicians improve their quality of care, embedding the patient's perspective into all levels of health care delivery, and helping patients gain access to higher quality and low-cost health care. She's also a PhD student focused on studying patient-reported outcomes in dialysis patients. Her passion is just not a hobby, it is her way of life. She is dedicated to helping kidney patients in whatever way she can. Amanda's also a kidney patient. She has SFGS for the past 16 years. Her kidneys failed as a senior in undergraduate study. She was placed on hemodialysis. She received a kidney from a friend in 2013. That transplant proved ultimately to be unsuccessful. She was placed on peritoneal dialysis, began studying for a master's degree. She received her second transplant from another friend, 2 live transplants, in 2014 and has 100% kidney function ever since. Amanda is the vice chair of the Kidney Health Initiative Patient and Family Partnership Council. She also works with NephCure Kidney International and the National Kidney Foundation to advocate for policy and research. She also works with pharmaceutical companies, Gilded, Goldfinch Bio, AstraZeneca, that include patient-reported outcome measures in every stage of the device and drug development. She has been involved with technical expert panels led by the University of Michigan Kidney Epidemiology Cost Center. I got to put my Poindexter on tonight. And the Centers of Medicare and Medicaid, and has served as a peer reviewer for the Department of Defense congressionally directed medical research program. Amanda believes her diverse background as a professional and in a clinic quality and research will provide a unique perspective in her kidney advocacy efforts. So please welcome my good friend, Amanda.
Hi.
How are you?
I'm really good. How are you?
I'm good. I'm good. Okay, let's talk a little bit about you.
I didn't know you were going to see my full bio. I feel like you said it all. But
well, you know, I thought about reading your resume, but I thought that might take a week.
yeah,
Oh, seven pages. My friend is so smart, you know. Yeah,
thank
I
you.
used to be a notary public, so we'll work from there. Tell me a little bit about your kidney history. When were you first diagnosed with kidney disease? What was that like?
So I was diagnosed in 2004. I was 14. It was right before I entered high school. And that whole summer, I didn't notice, but my mom noticed that my eyes were swollen. And I didn't think anything of it. We thought it was allergies. And then I started noticing that my pants were kind of hard to buckle, which I've never had that issue. I'm a very petite. I've always been really petite and little. So I was like, geez, I really need to start working out before I get into high school. Well, I went on a vacation in July that summer with my family. It was the first time we had flown on a plane. We went to go visit my aunt who lived in Virginia. And the next day when I woke up on the vacation, my body had exploded with edema. I had it everywhere. I could hardly walk. I couldn't bend my knees. So we actually went to the ER. Naturally, that was really scary. I didn't know what was going on. No one knew what was going on. And I ended up getting admitted, which is pretty scary when you're that young. And I had never been out of state, so I didn't really know what was going on. But they did some tests, and I didn't know at the time, but they told me to follow up with a kidney doctor when I got back. So that was the very beginning of it, but I didn't know what was in store for me. But I ended up getting a biopsy at Children's Memorial in Chicago, and they diagnosed me with minimal change disease, which is supposed to, it makes you leak protein in the urine. it can be pretty mild, it can be pretty severe, but it doesn't usually cause kidney failure. So I was relieved about that. Went on prednisone for a long time, couldn't get off of it. Every time I would get off of it, I would relapse. Because of that, I actually had to start chemotherapy about a year after that happened to try to get off the steroids and try to get me in remission. And that didn't work either. So I was 15 and bald and on high-dose steroids. But I ended up going to the hospital for almost a semester in and out when I was 16 because I couldn't get myself off of that medicine or couldn't get in remission. So they did another biopsy, and they found out I actually had FSGS. And at the time, not much was known. There's actually been a lot of progress in the FSGS space recently, but back then nothing was known about that. So that was really terrifying.
I can imagine. You were only 14. Can you give us some idea of, as a pediatric kidney patient, what your concerns were? What did you feel like? It couldn't have been comfortable for you.
I was honestly terrified for a long time. No one really, I had good doctors, but no one really told me what having FSGS meant. And I've always been involved, like really interested in sciences and healthcare, and the stuff that I found wasn't good and not very comprehensive. So I actually lived most of my teenage, well into my young 20s, thinking that I was just going to die. So I was really scared a lot. So yeah, I didn't know if I was going to be an adult. That was one of my main concerns. I didn't tell anyone that. I didn't want to burden my family with that. I thought maybe if I spoke it out loud, I might speak it into existence. But yeah, that was my main concern.
Okay. And when you went on dialysis, were you placed in a pediatric center? Were you placed in an adult center? How did that work?
So my kidneys failed actually 8 years after I was diagnosed. So there's different kinds of variants with FSGS. I don't know which one I have actually, because when I was diagnosed, they didn't even know that there were different variants. But about 8 years later, during my senior semester of college, I went into kidney failure, and I didn't understand why. So that's how much I didn't know about it. And I had actually just transferred from my pediatric hospital to an adult hospital. And I was placed on in-center hemodialysis.
Okay.
It was just a regular hemodialysis facility. I was 22 at the time. This was in 2008. I'm not 2008. It was January 2012. And yeah, I was the youngest one there. I didn't see any other younger people.
Okay, so you were placed in with older adults then as well as yourself.
Yes, I was. A lot of stories. My facility had pods. I was in Fresenius, and I was actually placed in the same pod as a woman she was very old, but she had a stroke, so she would just shout all the time and scream, and that made it. I mean, dialysis is stressful in general, but when you're in a facility where people are always screaming and don't know what's going on or begging for help, that just doesn't help the experience at all.
Okay. So how long were you on? I mentioned in the beginning, your introduction, that you've been transplanted twice. How long were you on dialysis the first time before you were transplanted?
Yeah, so I actually never stopped. So I started in January 2012. I was transplanted on March 4th, 2013 by my friends. And I was on hemo that whole time. And that kidney didn't work out. I had it only for 3 weeks, but I was in the hospital for a month. So that kidney didn't work. But I never got off hemodialysis. So I actually stayed on it for maybe 4 more months. And then I just couldn't handle it anymore. I switched to peritoneal dialysis, which I didn't know about when I started dialysis. Right. And had never heard of that. That was one of hemodialysis is never fun, but I was one of those that probably wouldn't have survived if I stayed on hemo any longer. I actually almost died a month before my transplant because of hemodialysis. Wasn't cleaning me out good enough.
Okay. When was your second transplant?
My second transplant was almost exactly a year later. It was on March 19th, 2014. And another one of my friends gave me her kidney. She was in nursing school with me, and we were actually RAs on the same floor in college. So I'm very lucky.
Two live transplants in one lifetime. That's excellent.
Yeah, I'm still amazed that happened to me.
So tell us about your quality of life after the second transplant. What has your life been like?
I never thought that I would live this way. It was probably my wildest dream. Growing up with FSGS, if you know anything about it, the outcomes aren't really great. So I had been told by a lot of doctors and varying healthcare professionals that I would never get better, than that. Even when I get transplanted, that my kidney probably wouldn't work. My FSGS would come back. So when I woke up right after my second transplant, I was actually shouting. I couldn't see. I was shouting and asking if she was working. Yeah, which was my kidney. And she was. My creatinine dropped from about 16, almost 17, to about 1.03. And then the next day was 0.63. I felt amazing immediately. Like I had never felt that way before. My parents actually brought me pizza while I was staying at the hospital. And I didn't know that's what pizza tasted like because I hadn't had normal taste buds since I was probably 13 because of kidney disease. So it's been great. I actually moved out of my parents' house 3 weeks after I got my transplant. I was really determined to start living my life the way I had wanted. I started PD when I was in graduate school. So I was getting my master's of public health and started it on PD and ended it with a transplant. So that was awesome. And about a year after my transplant, I got my first job as a researcher. It's amazing how my life is now.
One of the things that I admire about you the most, Amanda, is that you have taken your kidney experiences and applied them to your education, and in turn, you have a very patient-centered approach. Would that be a fair statement for me to make?
Yes. I've always been interested in sciences since I was a little girl. I remember having like a research journal when I was like 7 or 8. But definitely getting kidney disease inspired me to start getting into healthcare. I wanted to start as a nurse. I didn't really know much about healthcare. I'm a first generation college student, or I was. So I thought nursing was going to be the way that helped me. But my college actually kicked me out my last semester when I started dialysis. So a lot of things were going wrong at that time, but I didn't know it was going to work out that way. And I discovered public health, and I thought it sounded really interesting. And I always really liked to research, so I just decided to jump in. I didn't exactly know what it was about completely, but I'm actually really lucky that it worked out for me because now I can actually help populations. That's what public health is all about. So studied to be a researcher. Professionally, I do that. I don't work with kidney disease in my professional life. I actually do anesthesia research right now. I've done dermatology and plastic surgery previously, but I work with a lot of organizations that are involved in kidney research. I work with a couple of pharmaceutical companies on what we call patient-reported outcome measures. And you might be familiar with them if you've ever gone to the doctor and if they've asked you if you've gotten a flu shot this year or if you've ever rated your pain on a scale. That's what a patient-reported outcome is. It's a way of getting data directly from the patient to evaluate what they're experiencing. So it's also a priority by the Centers of Medicare and Medicaid, and I do that at work. So coincidentally, everything that's happened actually lined me up perfectly to start advocating. But one of my main projects with the Kidney Health Initiative is actually focused on patient-reported outcomes and developing them for novel renal devices, which means futuristic devices that will replace kidney function, like the wearable kidney or the artificial kidney and other technologies. But We've actually moved into the quality of life domain for that. So we're not just evaluating symptoms anymore, but we're taking a look at quality of life issues, specifically in dialysis. And as you know, when you go on dialysis, it's, especially in the United States, you're just placed on hemodialysis, regardless of what your circumstances are. Me personally, I was 22 and placed on in-center hemodialysis, still in college, and I should have never been placed on that. As a 22-year-old, I was very active, and my life had to go on halt because of that. But patient-reported outcome measures in renal replacement therapies will allow patients to direct their care and help them prioritize their individual goals and values. So, for example, if you're questioning someone on what their most important part of being on dialysis might be, like someone might want to travel, someone might want to go to school, you have to find the best modality for that. So this is a way for patients and physicians and other people in the healthcare delivery system to work together to make sure that dialysis is patient-centric.
Excellent, excellent. One of your mentors is one of my good friends, Kevin Fowler. Can you talk about Kevin's influence?
Yeah, he actually lives across the street from me. I didn't know that until last year, but we were both involved in the Kidney Health Initiative Patient and Family Partnership Council. That's how we had met, and he has since moved on to the board of directors, and I actually recently replaced his role as vice chair on the council. But he's excellent. He's connected me with a lot of opportunities. I've been learning a lot from him, and I'm really lucky that he's a mentor of mine as well.
Well, you couldn't work with a more patient-centered guy than Kev. Absolutely not.
Oh,
that's his big thing.
I completely agree.
Okay. Give us the down and dirty on your educational experience. I know you touched on it a little bit, but just briefly, where you're at with your education, what's happened.
Yeah, I decided to take my research to the next level because I really want to contribute to the science of patient-reported outcome measures in dialysis. So I'm currently a PhD student at Northern Illinois University. So I'm completing my first semester next week. So I'm really excited about that. I actually just published with Kidney Health Initiative on what my dissertation will be about, which is I kind of just described it as patient-reported outcome measures and the intrusion of family and social life on dialysis. And we actually have a publication that came out about 2 weeks ago on that. But I'm looking to make sure that clinical trials, device trials use patient-reported outcomes, and that patients are included in every step of the healthcare delivery system, because patients should be the ones that are directing their care. And patient goals are usually different than physician goals.
Okay. Give us a little amplification about your employment experience.
Yeah, so I started as a researcher, an entry-level researcher 5 years ago at the American Society of Plastic Surgeons. And I developed clinical practice guidelines, which mean we're looking at the best available medical literature and developing guidelines that all plastic surgeons in the U.S. will practice by. And that was actually my first introduction to quality measures. So quality measures actually take a piece of the guideline that tell physicians how to practice and measure them on how they're performing. So this is implemented. It's actually federally mandated. It's in all hospitals, but it measures to make sure they're doing the appropriate thing for the patient. Sometimes they can be a little controversial, but yeah, that's how I started. And then I also work with some data registries as well. And I moved on to the American Academy of Dermatology. So I was actually a senior researcher there, and I focused on just quality measures. That's kind of where I honed my experience in patient-reported outcomes and just quality measures in general. But my focus was on melanoma. And now I'm the manager of research at the American Society of Anesthesiologists. And I kind of do a little bit of everything. So now I can kind of direct how we're testing these formulas. And I also develop alternative payment models.
I know that you can't see the comments on the screen, but I'm seeing them, and so far 2 or 3 of the ladies that have checked in are talking about what a great inspiration that you are, and you know, what a wonderful circumstance you're in. So congratulations to you on that, my friend. You also do a little consulting with the American Society of Nephrologists. Can you tell me a little bit about that?
Yes, so I mentioned a little bit of this. So I'm the vice chair for the Kidney Health Initiative Patient and Family Partnership Council. And that is actually an extension of the American Society of Nephrology. So it's a public-private partnership with FDA to ensure that patients are included in every step of the care delivery process. And we're specifically looking at new innovative approaches for treatments, drugs, clinical trials, and the like. So I'm actually involved in a couple of research projects with them. One of them I already mentioned, which is patient-reported outcomes in novel renal devices. I'm also working currently on patient-reported outcomes for muscle cramping and hemodialysis. So that's looking at how cramping is affecting quality of life in hemodialysis patients, which is currently a space that doesn't have a lot of evidence in it. And it hasn't been very well studied. And if you've been on hemodialysis, you can understand how incredibly painful muscle cramping is. And
yes,
yeah, I had pretty bad ones when I was on it. And then my most recent project that's kind of just getting started is patient-reported outcomes for vascular access in dialysis patients. So more to come. We actually met yesterday. David White chairs the council. So
another friend of mine, David, good guy.
Yeah, he's great. So we're just kind of ramping up this year. We've had a little bit of delays because of COVID, but it's definitely not slowing the council down.
Okay. One of the things you made me promise to ask you was about your kidney advocacy. So I want to give you a chance to talk about that a little bit. Tell us, you know, there's all of this advocacy focus on patient centering. So tell us a little bit about your kidney advocacy.
Yeah, so the main one was what I just mentioned with the Kidney Health Initiative. I've been involved with technical expert panels with the Centers of Medicare and Medicaid and the University of Michigan, which solicits feedback from physicians and patients on various topics. That was actually the first way I got involved in advocacy, but my actual job was kind of what pushed me into it. I didn't know that it was going to do that, but I would definitely not have known about quality measures if I didn't become a researcher in this space. But I also work with the National Kidney Foundation for my region. Work with Gilead on their scientific advisory council, Goldfinch Bio. I make sure that they're including patient-reported outcomes and patient-centered therapies when they develop new drugs. And I work with AstraZeneca for patient-reported outcomes for new drugs in anemia. But I just want to encourage people to become involved any way they can. If you see an organization that you really like or connect with, definitely reach out. You can reach out to me. I like to think of myself as I wasn't a very quiet person about being sick. I was always talking about it and always speaking my mind about it. You have a story, and your story really matters. And that's what's pushing all this new innovation. There's been a lot of exciting things happening the past 2 years just in the kidney space that we've never seen before. So I definitely want to encourage everyone to get out and do that if you're able.
Well, we always tell people, Amanda, when we send them out to advocate for us, particularly when they speak to legislators, that the most important thing that they can do is to tell their kidney story. That is the one thing that seems to stick with those individuals, both the staff and the actual member of Congress himself or herself. So it's always very, very important to tell that story because, frankly, as you know, we're the experts in what it's like to have kidney disease. They're not. And so they need to, in order to act on our legislation, they need to know, how it feels to be one of us, or at least from our perspective. I know that you've done some work on COVID too. Can you talk a little bit about your COVID-19 experience?
Yeah, we're actually getting ramped up for that right now. I haven't worked on anything specifically in the kidney space for it yet, but I'm working with a social worker who works at a university. She's a nephrology social worker, and we're trying to call out attention to the fact that there's not a lot of information out for transplant patients. I know within the past 2 days, there's actually been a little bit of information, whether it's like a study or data that's been sent out based on what's been going on in China or in the US. And I know the American Society of Nephrology actually just posted on Kidney News some resources, but we're trying to call out to attention that transplant patients kind of feel out of the loop and they're not really certain what to do. It can be confusing because as a transplant patient, you probably feel like, as you should, a normal, healthy person, but you're high risk, so there's certain precautions that you have to take. And we're kind of tying that into how there's a lack of education in transplantation after you get the transplant. So there's a lot of work that's done to make sure people get transplanted, but then afterwards it's kind of like you're on your own. My center does a really good job. I just want to say they do an excellent job at educating their patients after transplant, but yeah, we're trying to tie both of those issues together. So that's what I've been doing, kidney related. So stay tuned for more. We're about to launch some of that stuff the next couple of weeks. The rest of my COVID activities have actually been with my work. So because I work with anesthesiologists, they're frontline workers and they're intubating patients that might aerosolize COVID when they're with patients. So we've, worked with people in hospitals to make sure that the ventilator supply doesn't really go low. So we've learned how to convert anesthesia machines into ventilators. And recently we've actually worked on what are the guidelines at restarting elective surgeries. Probably not as interesting, but I think the work's really valuable and it helps me advocate better.
Well, that's a very big issue, the elective versus mandatory surgery for kidney patients, because people have problems with their access, people that are trying to get transplants, people that have other issues. Like I used to have narrowing in my fistula frequently, and they would do angioplasties. It seemed like they were doing one every 6 weeks or so when I was on dialysis, and all of that is up in the air right now. So thank you for working on those issues for us. I appreciate that very much.
Yeah, definitely a lot of work needs to be done in the space, and I'm hoping that things will kind of normalize a little bit with elective surgeries. We were talking previously that transplants, we don't consider transplant an elective surgery. It's certainly life or death. I know that I would have died if I didn't get my transplant. So, yeah.
I have so many friends that have been complaining because they had transplant dates that have been put off or pushed back.
Yeah, I know someone recently who actually just was transplanted, but I've been hearing some data from certain states that they're like doing less than 20 transplants a month. And that's really sad. We've been doing a lot of work to make sure people are getting transplanted, and we want to keep the momentum going to make sure that people can get their transplants. We also want to make sure that patients that are having issues that aren't transplanted, like you're mentioning, you had access problems, that they are getting help when they need to. Just because COVID is happening doesn't mean that you shouldn't go in to get help. So make sure that you're calling your providers if you're experiencing any issues.
Good. Now, you sent me a couple of things where either you were part of a writing team or things that you had actually written yourself. Professional publications is the way I should qualify it. Can you talk to us a little bit about your writing experience? Because obviously you're prolific. I read your resume, and there's a lot of mention of articles on there. So talk to us about that a little bit, Amanda.
Yeah, so although I was a nursing student, I was actually a double major in my undergraduate studies. So as well as nursing, I studied research methods in psychology. And when I had to drop nursing, or when I was forced out, I graduated with my bachelor's of science in psychology. and didn't know it at the time, but it really helped me learn how to write scientifically. And that's something I've actually always enjoyed. I've always enjoyed writing, but scientific writing is certainly a passion of mine. When I got my first research job, I published in Plastic and Reconstructive Surgery. That's the official journal of the American Society of Plastic Surgeons, on quality measures. And I really, really enjoyed that a lot. So I looked for other opportunities to do that. And the main way I've actually been publishing is through the American Society of Nephrology. So like I had mentioned previously, our article on patient-reported outcomes and novel renal devices was released 2 weeks ago. That is behind a paywall. So if anyone's interested in reading that, you can contact me directly and I can send you the publication. I've also published on adolescents and young adults and the use of kidney transition centers. So another passion of mine besides patient-reported outcomes is transitioning patients from pediatric care to adult care. And my experience being 14 as a patient, I didn't feel like a child, and the services that were offered to me, in a pediatric hospital weren't really interesting to me because I wasn't, I didn't feel like a child. I was a teenager, but I didn't really exactly fit into adult care either. I felt that I was treated very harshly by people who were providing my adult care. So how do we get patients that are transitioning comfortable enough to take ownership of their care and make sure that they're developing the habits that they need to keep themselves or their future transplant healthy? So that's definitely another issue that I'm really passionate about. And I've also published on clinical endpoints for trials, specifically with GFR and protein in the urine.
Okay. So a lot of writing experience. I noticed that last year at the ASN Kidney Week that you gave a talk there last year. Is that right?
Yeah, that was my first academic lecture. So I was pretty terrified, but I was really lucky that the Kidney Health Initiative and the American Society of Nephrology allowed me that opportunity. I was part of a session with 3 or 4 other people. Can't remember at the top of my head because I was that scared, but I presented for 30 minutes on patient-reported outcome measures and how to maximize their use in clinical trials. So really, I was speaking to device and clinical trial investigators and nephrologists who are interested in researching patient-reported outcomes. And what that means is getting patient input early and often, so not getting patient input after the trial results have come out or when you need marketing done for the drug or whatever you've developed, but at the beginning. So when you're developing a clinical trial or a device trial, you're trying to measure some sort of physiologic or anatomical functioning. Patients, care about that because if you can heal part of whatever physiology is wrong, then ultimately the patient will feel better. But a lot of times it doesn't work that way. So you should be measuring clinical trials with a patient indicator alongside. So for example, if I developed a drug that's going to make anemia better for patients, that might not sound as appealing to patients. They might not understand how their anemia is affecting them in day-to-day life, but perhaps how tired they are is affecting them and their weakness and their fatigue. So if you're measuring fatigue and vitality alongside physiologic function, then that makes the trial stronger and gets patients buy-in early on. So you're prioritizing the right treatments and the correct drugs that patients will actually want to be on will be developed.
Okay. Do you anticipate that you're going to be doing any lecturing in the future?
I don't know. Hopefully. Kidney Week, I'm not sure will be happening this year just because of COVID, but I'll certainly present if I'm asked to. I am working with a couple of pharmaceutical companies, so I've talked in some other town halls, but hopefully that was the first of many lectures that I'll be giving.
Okay. Tell us what you're doing now. What's new? What are you working on now that you didn't put in your resume or you didn't send me in your bio? What's the new stuff?
Right now I'm kind of focusing on reaching out to other organizations that are conducting research to make sure that the patient perspective is included. So I'm in the process of reaching out to other companies, pharmaceutical companies, organizations who are trying to learn how to engage patients or need a methodologist, because I am a trained methodologist. The Kidney Health Initiative Patient and Family Partnership Council has a lot of exciting things coming down the pipeline as well. I don't think I'll get into them because we haven't started advertising what we're working on yet. But okay. I encourage anyone to look at the page and see what projects we're working on. But not much new. It feels like I'm always working on something kidney related, but an advocate never rests. So
true. Very true. Is there anything I haven't asked you about tonight that maybe I should have, that I left out? Bad Uncle Jim.
No, you didn't leave anything out. I guess whenever I talk to people, and you've talked about this earlier too, that you should always speak out. I think sometimes as patients we can get scared, and I know I experienced this during my first transplant, but I knew something was wrong, and I knew I shouldn't have been treated the way I was treated, and I know I was placed on therapies that I didn't really want to be on, or I know that I would have gone about some things a different way than it was instructed. But you just have to speak out, because that's the only way that your voice is going to get heard. That's the only way that you're going to change things. I had to fight a lot to get what I wanted done. So that means changing institutions or calling your doctor every day to make sure that of the status of whatever labs. You just always have to speak out. Don't be afraid to. I know it can seem daunting or scary, but that's the best thing that you can do. And if you don't advocate for yourself, no one else might. So you really got to take your care into your hands.
That's what I've always been taught too. You are your own best advocate. Along those lines, Amanda, you mentioned something to me in some of our conversations to prepare for tonight's talk about the way you were treated when you first went on dialysis. Can you talk about that a little bit?
Yeah. So when I actually transitioned from pediatric to adult nephrology, I was 21. It was in December, so I was about to turn 22. And I was scared, but I was also excited because I finally felt like an adult. But when I transitioned to this new hospital and I met my new adult nephrologist for the first time, she walked in and said, she didn't introduce herself. She just walked in and said, "Oh, you're from so-and-so Children's Pediatric Hospital. You're going to wish that you were still there because we don't treat people as nicely here." And I really feel like that set the stage for the rest of my care there. I was only there for maybe another year and a half, but that was, that was terrible. I definitely felt like no one was on my team that was taking care of me. Obviously, I had friends and family that were supportive, but yeah, you shouldn't be talking to patients that way. You should be wanting to help them. You shouldn't take pride in maybe cutting them down a little, but I eventually, was placed on hemodialysis because I couldn't get a preemptive transplant. I should have known that my kidneys were failing. I was in stage 4 and I was incredibly ill. I could hardly breathe.
Sorry.
But I was just placed on dialysis and I didn't know what that even meant. And I was a nursing student, so I should have known what that meant. But I was so terrified to learn anything about dialysis because I thought it was a death sentence, so I just never read it. So I was terrified. I was like screaming first time that I was placed on it. I had a permacath in my chest the entire time. I actually never got a fistula or a graft, but I didn't know what that meant. So it was a really unpleasant experience. And My clinic, as time went on, wasn't great either. Yeah, I was treated, everyone should be treated according to their values and their goals, but it just seemed like I was a number, just placed on the machine, didn't care how I was feeling, didn't care where I was placed, didn't care that I was 22 and trying to graduate college. Yeah, they just put me on it, even though it wasn't good for me. But that's why I work really hard to make sure that there's a way to engage patients early and often about their care so that they can tell their nephrologist, whoever's taking care of them, what actually matters to them. So if I was educated on my options, I would have gone on peritoneal dialysis, and perhaps I could have spent more time in school, or, could have prevented getting pulmonary edema because I wasn't getting enough dialysis, just things like that. So hemodialysis was a terrible experience. Okay. I wouldn't wish it to anyone.
Okay, and tell us, what was the advantage to being on peritoneal and home?
If for people who knew me when I was on hemo and PD, they probably would have thought I was crazy to like PD even more, because I had a lot of problems on PD. At one point, I was getting surgery every week because my stomach catheter actually kept flipping upside down and not working. So I was actually getting surgery every week to fix this before they finally switched it, tied it down, or stitched it down into my abdomen. But I was also doing 12 hours on the cycler every night, and then 1 to 2 manual exchanges a day. So that's like 16, 17 hours of dialysis. But what I liked about PD compared to hemo was that I was in my home. I was with my family. My friends could come over. I could talk with them. I could feel comfortable in my own bed. I could sleep while I was on dialysis. I connected myself. I hated when my dialysis nurses would connect me, or the technicians, because I was, trained on sterile technique. It seemed like they just changed it and didn't really care about the quality of changing it. I actually got catheter infection from that. I was able to shower again. I didn't shower like a normal person for 1.5 years on hemo. So it was like basic life things that, you kind of almost take for granted that I wanted to be able to do that I couldn't do on PD. So, yeah, and just overall, I felt better. I didn't get washout. I did really horribly on hemodialysis. I pretty much was never recovered. I would have my day off and be sick all day in bed after dialysis, and then have to go back to dialysis the next day. But PD allowed me to take care of myself, and I didn't want anyone taking care of me besides myself.
Like you said, you're your own best advocate.
Mm-hmm. Yeah, PD was everything to me. It really was. It gave me a peace of mind, and I'm really thankful for it.
All right. Well, we appreciate you taking time to talk with us tonight. And as I said, the reason that I respect and admire you so much is you've taken a lot of your experiences and brought it to bear on your work, and you do fabulous work. When are you expected to finish your PhD program?
I take my candidacy exam in the spring next year, and then hopefully I'll start writing in the summer, and I should be done in May 2022. Hopefully, keep your fingers crossed.
All right. So unless the audience has questions, does anybody in the audience have questions for Amanda? Matt Snyder says, "Great job, thank you." You've got an awful lot of compliments tonight, my friend.
Thank you.
Our good friend Lisa Baxter was on a catheter for 3 months and switched. Matthew's telling us he's had 4 kidneys. 4 kidneys, wow. Megan's telling us she switched from hemodialysis because peritoneal didn't work for her. 7 years altogether on PD, and 2 failed. Apparently she has children.
No, she calls kids kidney. Her kidneys are kids.
Oh, I see. Okay.
I know her very well. Actually met her through NephCure when I was working with them to develop like a network for young adults. So she actually.
Yeah, she said you're her inspiration.
Thank you, Megan. That's really sweet.
Mary Hefferman, you are a resilient and brave woman. Proud to call you my friend.
Mary.
Got a few fans out there, Amanda.
Mary was my little sis when I was in a sorority in college. Thanks, Mary.
And TJ, you are awesome, Amanda. You made me cry with everything happening. You still managed to strive.
Thank you. It's very meaningful. But yeah.
My friend, I'm sorry. Go ahead, Amanda.
I was just gonna say, if anyone wants to reach out and need resources, they can feel free to do that. I know Kent actually. We participated in one of the publications I provided you on clinical trial endpoints.
Okay. My friend Kent Bressler, who's celebrating his 33rd transplant anniversary, had a preemptive transplant with a kidney from his brother. Wanted you to know that you did a great job. It's been a great program.
Thank you. Yeah, people who have had their kidneys for a long time really need to keep talking about it. I had never heard any stories before I got my transplant, so I just thought it was 3 years and you're done and you just pass, because again, no one educated me. So hearing those stories of inspiration are really helpful, especially to FSGS patients.
Our friend Matt Schneider is talking about his experience with pediatric patients, and that he has camps and visits that are related to adult healthcare. So your pediatric experience is inspiring people tonight too.
Yeah, that's what inspired me.
All right, I'm going to let you go then, Amanda. I know you got a paper to write, so as old Professor Jim, I definitely want you to turn in your paper.
Thank you so much for taking the time to speak with me.
Oh, thank you for taking time with us. We greatly appreciate it.
All right, thank you. Have a great night.
You too. All right, so that's our friend Amanda Grandinetti. Great job tonight from Amanda. I've got a few minutes, so what I want to talk to you about tonight is advocating with your legislators, and in particular, advocating with people that are running for election that might be your new legislator. So I'll give you an example. I have a friend who is a congressman that I've worked with for years and years, Pete Visclausi from the Northern District of Indiana, #1. His offices are in Maryville, and of course he has offices in Washington, D.C. He's retiring this year. So there are a couple of candidates that are running for his spot, which of course ends January 1st of 2021. So the idea here that I want to stress to you is you do not have to wait for these men and women to actually take the office to start letting them know, because like Amanda and I discussed, you are the expert when it comes to kidney disease. You know your story better than anybody else. You know what goes on with kidney disease better than anybody else, particularly in your particular case. So my friend Kent Bressler and I have been working on a project to help educate young advocates, and we'd be willing to do a presentation for anybody that wants us. But here's my point. You don't have to wait until these guys get elected. You know, the expression is get them while they're young. So don't be afraid to contact their campaigns while they're running for office. Ask them their position on kidney legislation, Living Donor Protection Act, immunosuppression bill. Start feeding them information now. It's a good habit to develop. Send them those one-pagers that make arguments for your various kidney organizations. Start sending them writings, materials, posts, get their position, show up at one of their live events if we're not in a COVID thing. If not, get on a Zoom and show up for one of their Zoom events. Don't be afraid to ask questions. Don't be afraid to stand up and say, I'm a kidney advocate. I'm concerned about these issues. I want to discuss this with you. Are you aware of, that type of thing? Let them know. Here's why you want to do that. You want to become their go-to kidney person. You want to become their go-to guy. If an issue comes up, or they have a question, or they want to deal with a particular issue, you want them to feel that they can contact you and say, hey, Jim, what about this? What's going on with this? This came up the other day. I have questions. You want to try to develop that kind of professional relationship with those people, because let's face it, we don't get anything accomplished legislatively unless we educate our legislators. Okay? And, when you talk to them, make sure they understand you're a constituent, you're registered, you vote, that kidney issues are important, that it is the 9th leading killer in the United States, that there are 33, 34, 35 million, whatever it is, those of us that are have kidney disease, chronic kidney disease, suffer from end-stage renal disease. Tell them there's 700,000 of us, 800,000 of us, whatever it is, on dialysis, that there's 100,000 people on that waiting list for a kidney, and that people really do wait. People die while they're on that kidney list. As my friend Kent says here, stay focused on learning all you can about kidney disease, and then pass it on to those folks, because they make all of the decisions that affect us. For example, the fact that Medicare covers end-stage renal disease, sees you as disabled, covers all of your costs for dialysis, which are very expensive, by the way. That came about because some advocate, someplace, talked to his legislator, her legislator, and the legislators came to the conclusion that this was important enough that it's a problem. We need to do something about it. And that came about because advocates went to their offices, went to their local offices, wrote them, sent them emails, kept them updated, contacted them every once in a while, saw them in their private office, whatever, but kept pushing that need for kidney legislation. So, my friends, there's a large turnover coming up in this next congressional election. There are a number of people that have retired. There are a number of people that don't want to be in legislation anymore. So there's going to be new people. Contact the people that are running. Pick the first 1, 2, 3 candidates in that particular race. Contact them. Send them information. Let them know your feelings. Let them know your positions. Send runs. Everything that you can do to begin to persuade them. Okay, because that's what I'm doing fine, Monica, thank you. That's what we're trying to do. We're trying to persuade them to accept our position, to do things like pass the Living Donor Protection Act. So, a guy that donates a kidney, a woman that donates a kidney, they don't get discriminated against at their employment. They don't get demoted. They don't get put out. They don't get paid less. They don't lose their benefits. They don't get discriminated against with their life, health, or disability insurance. You don't want, Bill Hahn and Rick Selleck are very, very good examples, Kent, thank you, of guys that got out, banged on some doors, talked to people, but you want to get them while they're young, okay? You want to get them, start talking to them before they get to Congress. It's a worthwhile investment. Kenneth is telling us that Amanda's a great kidney advocate, and apparently he likes the two of us as advocates together. Thank you, Ken. We appreciate. But don't be afraid to go to a town hall. Don't be afraid to do the Zoom meeting. Don't be afraid to show up at their office. Call their scheduler, make an appointment when times are better, and go in and speak to them about kidney issues, kidney legislation, the problems that kidney patients have. Make them aware. Most importantly, tell your story. Tell your story, because your congressman, your senator will remember almost 100% of your personal kidney story, like Amanda told her story tonight, right? You'll remember Amanda's story for a while because it's such a compelling story. A young girl, pediatric kidney patients, 2 transplants, 2 times on dialysis, bad experiences, good experiences, better on hemo or better on peritoneal than on hemo. Those type of things that you remember, and how she's brought her personal experiences to bear on her work, which is very important, and her ability to advocate. They will remember that. Even a staff member will remember about 80% of what you tell them about your personal kidney story. So don't be afraid to do that. You know, let them know the ins and outs of this. I'm Jim Myers. I have polycystic kidney disease. I have 5 members in my family that had polycystic kidney disease, like my dad was one of those people. I lost all of those people in my family. They all passed away from renal failure, uremic poisoning, congestive heart failure. And I'm the only one in my family that ever had a transplant. You know, I was diagnosed young. I was diagnosed when I was 25. I was on dialysis when I was 58. I was transplanted at 62. You know, the transplant has made a big difference in my life. The lifestyle is much better. I'm much healthier this way. I take better care of myself. I'm able to do that. Part of the reason that my time on dialysis was so short, and I was transplanted, is because I was diagnosed early. I was taken care of early. I was told to take high blood pressure medicine. They checked on my blood pressure and my vitals, the protein in my blood every month down at IU Health for a long period of time, and that made a big difference to me because they kept the state of my health at a certain way. That made dialysis easier for me. That gave me the ability to be transplanted. See, it's those personal stories like that are the most compelling and the most important. So do not be afraid to tell your personal story, even if it hurts a little bit. You know, even if there are details that sting a little bit. Don't be afraid to tell those guys, and don't be afraid of them either. Okay, you are the kidney expert. You are the expert in your field. They don't know anything about that. That's the assumption you have to make. They don't know anything about that. And then you teach them, all right? You teach them. Work with their staff, as my friend Kent says. Meet with those legislators. Write to them. Update them. You see an article or something that is important, make sure you pass that along to your legislator, even if they're contrary to you. Even if when you see them, you know, because I had a guy years back that he used to come out in the meeting room, the waiting room, you know, before you drag you into the conference room, and he'd say, "I'm not going to do anything for you guys today. I want you to know that. I really don't care. You know, I'm not going to do anything. You keep talking. You keep talking." The great kidney advocates have taught me, you keep talking until they listen. Keep talking until they listen. All right, my friends, that's my show for tonight. I'll see you at the end of May on the 24th. I have something extra special for you. The president of the National Kidney Foundation, Dr. Holly Kramer, is going to come on and talk to us, and we will talk about kidney legislation and issues on that broadcast, so don't miss it. Okay? All right, you have a good night. See you soon. Don't forget about our friends at the AAKP. High Potassium Awareness Day today, May 1st. Also a great organization. So I'll talk to you soon. Thank you for taking time to check in with your Uncle Jim. You all have a good night.